Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy channel. Actually, today's video is an extension of my previous topic, that is diabetes mellitus, maturity onset diabetes mellitus. I have made, because of the time restraint, I have made the two parts. First part maybe half hour, second part maybe half hour. But I request all of you, as this disease is very, very common nowadays, because of our wrong food habits and wrong lifestyle, but at least you should get the awareness of diabetes mellitus, and I am making this topic very easy and very simplified. So myself is Dr. R. Deshpande. I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. Of course, when you come to me to get the treatment for diabetes, I will treat you according to the Ayurvedic principles and Ayurvedic medicines. Okay. So this is my WhatsApp number 9226810630. Today's video, of course, I have already upload my audios regarding diabetes and Ayurvedic management. Remember my words, diabetes and Ayurvedic management. This video is already existing on my YouTube channel. So you can just, with the headphone, you can hear that very interesting discussion about Ayurvedic approach. But this video is related with the allopathic treatment. So we will discuss about anti-diabetic medicines, especially in this section. In my first part, I have discussed the types of diabetes, causes of diabetes, symptoms of diabetes, then investigations of diabetes. So everything has already been in the part one. So you also check part one, and then you can come on this platform of part two. Okay. So directly medicines, oral hypoglycemic agents, OHA. This is pharmacological word. In routine practice, we say diabetes tablet, diabetes tablet, diabetes tablet. But in pharmacology, it is called as OHA, oral hypoglycemic agents. That means tablets. There are two types, sulphonylurea group. This is A group. It contains tablet tolbutamide. That is, this is a generic name. Many times I have given both generic and brand name. Generic and brand name. Brand name is the name given by the company. So tolbutamide means the same, Restinone tablet, 500 milligram. It can be taken twice or thrice in a day. But this is very weak in action and short acting. It will control blood sugar, but not very strongly. Okay, and it is very short acting. Then chloropropamide, which is not at all used nowadays. Remember my words. I know tablet Diabetes is outdated, is banned because of the complications. So 100 milligram OD, when it was given far back, 20 years, 30 years back, it was the very famous drug for diabetes in India, Diabetes. But no, nowadays nobody is prescribing and nobody is taking this diabetes, because this tablet can cause dangerous hypoglycemic attacks and also jaundice. So not in the current use, and it is banned. Next, glibenclamide. This is generic name, glibenclamide. That is tablet Dionil or Euglicon. This is very popular tablet, Dionil. Everybody, most of the diabetic patients are on Dionil. 5 milligram, very small, OD, once in a day or twice in a day. This is very strong but slow acting. Every pharmacological action I am also explaining you. Then next is a glipizide. That is tablet Glitazones. This is also popular. This is also used many diabetic patients. 5 milligram once in a day. OD means once in a day, or BD means 2 times in a day. This is very, very fast acting. So difference in Dionil and Glitazones. Dionil is slow acting and Glitazones is fast acting. This is pharmacological difference. Next, gliclazide. This is also latest tablet, latest gliclazide, that is Reclide 40 milligram or 80 milligram tablets, Diamicron 80 milligram OD or BD. This is tablet which is having anti-diabetic action, blood sugar will come down, but also anti-platelet action. This is the most advantage. So whenever patient is of heart, he has coronary blockages, fear of heart attack, fear of stroke, brain attack, paraplegia, hemiplegia, and diabetes together. Heart problem, diabetes, brain problem, diabetes together, fear of thrombosis, then gliclazide is the best tablet, because it controls the blood sugar as well as anti-platelet action. So there will not be any thrombosis. Okay. Then glimepiride. This is also these are the latest medicines. That is glypride. 1 to 2 milligram, very small OD, longer duration of action. These are the benefits of new generation anti-diabetic medicines. They are small in size, small in weight, and also very quick, very potent, very fast acting. Okay. So one step ahead this is a research in allopathy. Okay. Next. Second type, first was sulphonylurea, and this is biguanide. These are the only two, sulphonylurea and biguanide. Sulphonylurea, biguanide. These are the anti-diabetic medicine pharmacological classification. Very famous drug, metformin, that is glyciphase, 500 milligram, OD once in a day, or TDS 3 times in a day. But the most important, you must remember, this is for obesity. That means overweight plus diabetes. Obese plus diabetes, glyciphase. Obese plus diabetes, glyciphase. This action packed, Dr. Deshpande is explaining to you from the heart. So take it from me and write down the notes. Okay. Then acarbose, that is gluco-B, 50 milligram OD or BD. This blocks the absorption of glucose from intestine. Hence, it is used to treat postprandial hyperglycemia. There are some patients where fasting blood sugar is always under control, but after lunch, shoot up the blood sugar. So there you must use this glucose that will control the postprandial blood sugar, post-lunch, post-dinner. That is called as the prandial. Okay, PP, yes, lab PP. Okay. Then oral new, very latest drugs in the market, that is ripaglynide. This is not for family physician. This is for the super consultants, diabetologists, senior consultants. This is not for family physician. This is for not normal doctors, because these are having latest medicines, latest research. So ripaglynide, that is Urepa tablet, 1 to 2 milligram, very small but very quick action. Choti murti, but kirti mahan in Marathi language, we say that the stature is small, but the fame is very much. So similarly, Urepa is 1 to 2 milligram, but very potent. Then rosiglitazone, that is Result. Interesting name given by the company. Result, diabetic medicine, 1 to 2 milligram, but unfortunately, it is hepatotoxic. Hepato means liver. So when the patient is on Result or rosiglitazone, remember, when the patient is taking this tablet, he must do, diabetic patient must do LFT. Please write down, liver function test by the blood test. Liver function test by the vein in the laboratory every after 3 months to check whether there is a toxic effects on the liver. Hepato means liver. Then pioglitazone, these glitazone tablets, these are hepatotoxic. They are good, but they are hepatotoxic. So be careful. If the patient is already alcoholic, he is already having the history of hepatitis B, hepatitis A, jaundice, any liver cirrhosis, amoebic liver, don't use rosiglitazone, don't use pioglitazone. These are not for the patients with the liver problem, because this can have the complication of hepatotoxicity. Okay. So this I have mentioned that sulphonylurea, as far as possible, is avoided nowadays because of the induced drug, medicine-induced hypoglycemia. So when the patient is taking sulphonylurea drug, he should not miss the meal. No fasting at all. Do not suddenly increase the exercise, because there is a fear of blood sugar going down, and avoid the alcohol. These are the 3 things that you must remember for sulphonylurea tablets. Okay. So then we will go further. Prevention of sulphonylurea induced hypoglycemia. How it can be prevented? Elderly patient can suddenly go into the hypoglycemic state without warning symptoms. So prefer the weak oral hypoglycemic agents like Restinon. Although they are weak, it is okay. In front of our life, the effect should be slow. Slow and steady wins the race. If you take a very potent drug and get a hypoglycemic, what to do? So better start with the Restinon or Glynides. Try to decrease the dose of sulphonylurea from time to time. Okay, every time you have to reduce the dose for the family physician. Biguanides, second type. Fenformin is banned. There are two types, fenformin and metformin. In biguanides, there are two subtypes. One is a fenformin, which is not used nowadays. Now we are using the metformin. This is the drug. Okay. Fenformin is banned because the dust drug can cause lactic acidosis, which can be fatal. Acidic blood. Okay. Metformin, that is glyphosate, useful in the obese patients because it also causes the reduction in the weight. Double benefit. 1-to-1 free. Diabetes will be controlled and obesity will also be controlled. So that is the best drug, the glyphosate. Can be combined with other oral hypoglycemic agents, that is the other diabetic medicines, as well as insulin. Biguanides, there are also little bit side effects. Occasional diarrhea or heat burn, heartburn, I'm sorry, acidity. Hence, always biguanides are given after food only. So the family physician is also able to know the side effects or the complications of the drug, and accordingly he should advise the patient proper instruction, when to take the drug, how much should be taken, and what precautions should be taken, etc. Okay. So like sulphonylurea group, it has no action on the pancreas, but acts by suppressing the release of glucose from liver. So that glucose is stored over there. It is not released from the liver. Now glitazones. They are called as insulin and reduce the dose of insulin. They are very good substitute for the insulin. They are acting like an insulin. So they are like a tablets but mini insulin combined with other oral hypoglycemic agent and should never be used alone, because glitazones problems are there. They are very, very costly. So can cause increase in the weight also. So not good for obese people. And so don't use these glitazones for the overweight patients. Pedal edema and puffiness of face is also a side effect of glitazone. Okay, hepatotoxicity is common side effect. So LFT, liver function test, should be done frequently, every after 3 months. Drugs are new in the market. Hence, long-term side effects are still not properly understood. And biggest advantage of glitazone used in the patient who are on insulin and to reduce the dose of insulin, or the patients who are taking, there is limit, upper limit of that other medicines, that is sulphonylurea maximum. Biguanides have given maximum, but no use, and patient don't want to take insulin. Then if the patient is affordable, try for glitazones. Okay, this is the way. Management of diabetes mellitus. First 2 months only diet control and exercise should be advised by the family physician. If it is uncontrolled still with diet and exercise, again check the blood sugar, and patient with normal weight start with sulphonylurea group. Okay, if diabetes is not controlled within 2 months with diet and exercise, then start the medicine. If still not under control, that blood sugar, then you can add biguanides. If still uncontrolled, next step, go for glitazones. Still not controlling, go for insulin. So this is the management principle in diabetes. Go step by step, not in a hurry. First day, okay, start insulin. No. First diet, then exercise, then sulphonylurea, biguanide, glitazone, and then last insulin. Okay. So, okay, we will go further. Prescriptions, ready-made prescriptions, but only for the family physician's education, not for the patient, If mild diabetes mellitus, PP blood sugar is in between 160 to 200 milligram, strict diabetic diet, number 1, regular exercises, weight reduction in the obese patient, then blood sugar fasting and PP after 15 days. If normal, check, then after 6 months, nothing to be worried. If still blood sugar is high, then only you start the OH, oral hypoglycemic agent, that is medicines. For example, in the obese patient, glyphosate is number 1 for half OD after food or in thin patient. Okay, but if the patient is thin, then tablet semi-dionyl 1 OD before food. Okay, obese glyphosate. Then thin patient, dionyl, semi-dionyl 1 OD before food. If fasting blood sugar is normal but PP is high, then I have mentioned that glucobay or acarabols 50 milligram 3 times in a day with first morsel of meal. Remember, this is a costly medicine. So it is not, should not be prescribed for the patient who is not affordable for that particular medicine. Okay. Moderate diabetes mellitus, that is blood sugar is more than 250 milligram. Obese patient, start glyciphase 1 OD. Can you see before? Before it was half OD. Now what we are doing? We are giving 1 OD. If the thin patient, then diabetic glycine 1 OD. Before what we are giving, this is 1 OD. So try to understand mild diabetes, moderate diabetes. You can make a screenshot also. You can write down the notes repeatedly. My dear students, my dear young upcoming doctors, prescriptions, how to increase the dose. In the obese patient, tablet glyciphase 1 OD. If not within 1 month, within 2 months, then 1 BD. You can give maximum 1 TDS also. Okay. So tablet glyciphase 1 3 times in a day. Tablet dionyl also 1 OD you can start, 1 BD 2 times in a day, 3 times in a day. Then that means if it is not controlled by one thing, you have to add both the tablets. You have to add both the tablets naturally. One tablet is not controlling the blood sugar. So dionyl plus glyciphase, and in addition, if required, lastly, the upper limit has reached. TDS is the last limit. You cannot go 4 times in a day. Okay. Then you have to start with the insulin. This is the prescription management. In the thin patients, here you can see we have started with obese, glyciphase and dionyl, but in thin patients, dionyl and glyciphase, reverse. In thin, first give dionyl. If it is not controlled, add glyciphase. Is it clear? Sequence is opposite. In obese, glyciphase first, upper limit, then add dionyl. In thin patient, low weight patient, dionyl half OD, 1 OD, 1 2 times in a day, 1 3 times in a day. Okay. Then upper limit has reached, add glyciphase. First only 1 OD, then BD, then TDS, and still it is not controlled with the 2 medicines, then start the insulin. Okay. Now, how to determine the insulin dose? For example, you have to take the urine sugar. If it is blue, omit insulin. No need of insulin. If now there are glucose sticks are available, just to take the strip and then put it in the urine bottle, and you will get the reading with the color. Immediately with the color, you can identify how much is the sugar. Then green color, I'm sorry, there is a printing mistake, 1 plus sugar, that is start with the 10 units of the insulin. For the yellow color, you can give the 20 insulin. For the orange, 30 units of insulin. If red color, very high sugar, then 40 units of given soluble insulin. 40 units of soluble insulin. Okay. Check the urine sugar before breakfast, before lunch, dinner, and adjust the dose of plain insulin. Okay. Next. Now, next is a Lente Insulin for single daily injection. That soluble injection has to be given before breakfast, before lunch, before dinner, etc. But this is only one time. Dose of Lente Insulin is 2/3 of total units of plain insulin. Okay. For example, 50 years old male patient, urine sugar, breakfast green color 10 units, lunch yellow color 20 units, dinner green color 10 units. So how much total units? 40. Now 2/3, 40 multiplied by 2/3 is equal to 27 units of Lente insulin. 27 units of Lente insulin. If daily dose of Lente is greater than 40 units, what to do? You said only once, but if it is more than 40, no, then 2/3 before breakfast and 1/2 before dinner. Maximum in the morning and in the evening also little bit. If it is more than 40 units of Lente, you have to start with the soluble insulin. Then you can give the Lente insulin. And if it is still more of Lente insulin dose, divide it into 2 times. Okay. Next. If 60-year-old patient, another example, breakfast green 10 units, lunch orange 30 units. Okay. Dinner yellow 20 units. How much total? 60 multiplied 2/3. How it is? 40 units. Then 40 by 2/3, say 27 before breakfast and 13 units before dinner, Lente insulin should be given. So if total insulin still more than 80 to 100 units, then start human insulin. Do you understand? Human insulin. Dose of human insulin is less than 30% than bovine or bovine insulin. This is the difference in human insulin and bovine insulin. Okay. Types of insulin: short-acting actrapid injection, actrapid insulin. Onset is within 1 hour, peak is maximum 3 to 4 hours, and duration is for 6 to 8 hours. Intermediate acting Lente 1, start action in 1 to 2 hours. Peak is at 8 to 10 hours in the evening time, and duration is total 1 day, 20 to 24 hours. Okay. Long acting ultra Lente. Okay. Onset is 3 to 6 hours, peak 12 to 18 hours, and duration 24 to 36 hours. Pre-mixed, that is mixed-tarred. Mixed-tarred, onset is 1 hour, peak value is 8 to 10 hours, and total duration of action 24 hours. Okay, next. Diet. This is most important. I have already mentioned triad is there. Management triad, TRIAD. Don't forget this. Ayurvedic 3 Sutri. Ahara, Vihara, and Aushadhi. Never forget these words for any disease. Ahara means pathya, food control, diet control. Then Vihara, lifestyle control. That is exercise, etc., yoga, asana. And then the medicines. Third part is medicine. Diet in anti-diabetic diet. No, what to say? No, I will not take sugar of all sweets. From all sweets, you should not take any sweet. No cakes, no sweet biscuits, no jam, no honey, sweet drinks, sweet fruit like mango and grapes. No, for diabetes. Restricted. Chapati, roti, and bread. You can take it. Plenty. What you can do, whatever you want. All leafy green vegetables and tomato soups, cucumber, brinjal, cauliflower, ladyfinger, buttermilk, all types of salads or soups and salad should be the best favorite dish for the diabetic patients. Okay, next. Diet for diabetes, anti-diabetic diet. Regular timing is very important. For lunch, for dinner, for the breakfast, regularity. Sharp at 9 o'clock breakfast, sharp at 1 o'clock lunch, sharp at 8 p.m. In 4 o'clock little bit snacks, and at 8 or 8:30 final dinner. Then regular timing and restricted quantity of milk. You should specify 1 chapati only, little bit rice, little bit cup of buttermilk, etc. Careful in festival parties, because there is always what you can say, you get tempted. Diabetic patient, also relatives, they, oh, once in a while, what will happen? No. For diabetes, that strict discipline is the success and quality of life. Okay. No starving for longer period. Avoid the alcoholic drinks. Caution. Always keep the sugar or biscuits in the pocket and use it in slightest symptoms of hypoglycemia. For example, sweating, profuse sweating. I have discussed in part 1, diabetes part 1, Dr. Deshpande, Professor Deshpande. Palpitation. What is palpitation? Understanding your own heartbeats. Thak, 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 thak. That is palpitation. Hunger, excessive hunger, irritability, and slurred speech. Slurred speech. Okay, that is very important. Diabetic patients, caution. Then identity card in the pocket. If he is moving all around, he's mobile, then mobility is there, then keep the iCard, identification. If by chance he become unconscious on the road, anybody can take that card outside and read the paper. Okay, this is the XYZ person having this much age, he's having diabetic, and his home is like here, address, phone number. That is must for the diabetic patient. What should be the card? I am a diabetic. If I found unconscious, take me immediately to the hospital and use first 25% dextrose intravenous. That is must, because I have mentioned that hypoglycemic attack can be fatal, but not hyperglycemia. Okay. Care of the feet. Wash every time, dry, clean feet, and sprinkled lot of talcum powder to avoid any wound, any infection, fungal infection, to make it dry, because moist area is favorable for fungus, and fungus is always there with diabetes. Remember these words. Avoid walking barefoot even at the room, because who knows, get the wound, and in diabetic patient, wound healing is always a problem. Okay. Wear soft cotton socks and canvas shoes. New footwear with care because of the shoe bites. cut nails very carefully, and often bath make them soft. That means after coming from the bath, you try to cut the nails, not otherwise, because after the bath, after the water connection, that nails become little bit softer. Okay, next. Additional treatment for diabetic patients, capsule Biguanides, that is a B complex, plus zinc. Zinc is very essential for nerves. Okay, one OD once in a day. If severe long-standing diabetes mellitus or associated with peripheral neuritis for nocturnal emissions in the young boys, this Biguanides is very good tablet, supportive medicine. In addition to your anti-diabetic tablets or insulin, you must take tablet Bplex or Biguanides. Tablet Bio E 400 milligram OD. This is tablet Antoxid 1 BD you can take, because this is a what you can say prevent the what you can say the free radicals, and these are the antioxidants tablets. Okay, they will boost your immunity. So my dear friend, this is diabetes type 2, discussing with the allopathic management and overall diet and all these things. But these are the educational videos. Self-medication should be strictly avoided. Disclaimer. But these medicines, for the doctor's purpose, I am giving you a link. If by chance they are available on the internet, you can click the link and demand the medicines for home after the prescription only. So वैधानिक इशारा, कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्य की सलाह लेना बहुत ही जरूरत है. If anybody of you are suffering from the cerebral palsy, arthritis, motor neuron disease, cancer, attention, hyperactive children, idiopathic thrombocytopenia purpura, any chronic disease or autoimmune disease, Dr. Deshpande has Ayurveda Academy with good consultants and the experts in every field. Ayurvedic, I am saying Ayurvedic treatment, Ayurvedic. Although this video is allopathic, but you can approach to us for the allopathic support to your any problem. Okay, I wish you all the best, and you can WhatsApp me on 9226810630. Yes, definitely. If you like, then like, make it a like, thumbs up, and share this video. And please don't forget to subscribe my YouTube channel and press the bell button icon to get the intimation of the this type of the interesting videos. Thank you very much, and all the best. Take care, and bye bye.